Services Alliance quarterly meeting. My name is Fred Leyda, and I'm the Human Services Director for Beaufort County and the facilitator for the Human Services Alliance. A couple of meeting guidelines as we go through our second virtual meeting. Ben Boswell and Alec Bishop with Beaufort County will be moderating throughout this morning's meeting. So everyone please remain muted. Your cameras are optional. And we ask that you put any questions that you have into the chat. Ben will be monitoring the chat and will then respond throughout the meeting or interrupt the speaker if you have a question. So if you have any questions for our speakers, just ask them in the chat and Ben will pass them on so they can be addressed. Our first item on our agenda is to get our Alliance news and updates. Before I go into there, though, just in case we have anybody on the meeting who has never been a part of an Alliance meeting, let me give a little bit of background so you know what you're getting yourself into here. So the Human Services Alliance has been around for, over 40 years in one form or another. And we gather quarterly to try to stay connected with each other, stay up to date on what's going on in the community, and to learn new opportunities that become available. Our meetings used to take place in person. Obviously, with the pandemic, that's become a challenge. Hopefully, by our next meeting in June, we may be able to convene in person again. But I'm also going to ask in the future for folks to weigh in on whether or not they would like to continue having virtual meetings. We often hear from people in the Alliance that one of the most significant parts about being a member is the connections that you make with other people in the community, primarily at our quarterly meetings. And that's obviously very hard to do when it's a virtual meeting, since you're not actually in a room together and you can't get to know each other and introduce yourselves. So we're going to probably consider whether or not we will do all of our meetings virtually, or maybe some of them virtual and some of them face-to-face, so that we can continue to have that personal touch of getting together face-to-face. So the Alliance is a network of about 120 organizations. We cross all sectors in our community. So we have government, nonprofit, for-profit, military, faith, health, education, pretty much all of the sectors that are present in our community are represented at one level or another on the Alliance. And we've organized ourselves into work groups to try to have an impact on the quality of life in our community. The organizational framework that makes up those groups we call Together for Beaufort County. And we have organized into the groups to try to have a specific impact on a specific metric that gives us a sense of the quality of life in our community. Before I go into the updates and the news, does anybody have any questions? I have something in the chat. Ben, can you work with Tramaine? She says she's having trouble hearing. Okay. Not seeing any questions, so I will go right into the news and updates. First up, there has been some interest among the philanthropic community to try to expand or continue to try to expand our network into Jasper County. Jasper, if you have been around for a while, you know that Jasper has been trying to develop a Human Services Alliance for the last several years. It's kind of waxed and waned and had a little bit of a struggle getting started, but they're going to try to pull back together again for another meeting. That meeting is scheduled for April 8th at 3:30 p.m. and it is a virtual meeting. It'll be a Zoom meeting, so you can get the contact information from Ben to get the link to be able to join that. And obviously, with a lot of our organizations, we serve both Beaufort and Jasper counties. So we're hoping that all of the members of the Human Services Alliance in Beaufort, if you are an organization that serves both counties, please join the Human Services Alliance of Jasper County as well, so that that community can begin to develop a network just as robust as ours is. Next up, you may have seen in the newspaper that we have been working to try to impact the homeless situation in our community. Good news is the CDC has extended the eviction ban through June 30th. So for those of you who work with the low-income population and the folks who've been impacted, that's a breath of fresh air to know that we have a little bit more time to try to work with those folks and help them to be able to remain in their homes once the moratorium ends. But it's definitely good news to hear that the CDC has extended that through June 30th. We also have been presenting a proposal to County Council for the county to hire, for lack of a better term, we're calling it a homeless services coordinator. We realize that's not the best title, but it's a working title for us to get things rolling. We're working on the next steps to get that to happen. If it's approved, we expect that we'll begin posting for that position sometime in the fall of this year. The person would work one-on-one with homeless individuals, helping them to connect with resources, building a relationship of trust and respect that will hopefully encourage them to get the help that they need in order to become stable, independent. Next up, the next Together for Beaufort County report is scheduled to be released this summer of 21. We have seen a first draft and we're making final changes to get it ready. We expect to have that done very soon. We've had opportunities throughout the quarantine to brainstorm next steps to take Together for Beaufort County to the next level. There have been lots of great new data points and updates to the older ones that we've scheduled. For those of you who don't know, Together for Beaufort metrics began in 2006, and we have been tracking those metrics ever since, trying to watch whether or not the work that we're doing is having any impact in moving the needle. We expect to do a relaunch, hopefully aligning with the release of the report and the end of the quarantine so that everybody can be in the room together when we see that new information. It will be presented by the Riley Institute out of Charleston. They're the ones who are doing the report for us this year. And then note to any contractors, all contracts will terminate. These are all of our independent contractors that work with our work groups. All of our contracts per county policy will terminate on June 30 at the end of our fiscal year. That is a normal process, but for some of you, this is the first time you've been on a contract with us, so we just wanted to give everybody a heads up. Ben will be in touch with all of our current contractors to discuss the FY22 contracts as they come into effect. And lastly, the community services grants. We will be doing that grant process again this year. So watch for announcements and details in the Alliance newsletter to let you know when the applications will be due and how to get started into requesting that information. All right, any questions before I move to our speaker?
I'm afraid this is an obvious one that I probably should have put on the agenda, but do you want to talk about our move?
Oh, yeah, good point. So we are in the process of moving our office over to 500 Carteret Street. That's the old bank building that's across the street from the Chocolate Tree on Boundary Street Carteret Street in downtown Beaufort. And we anticipate that we will be making that move over the month of May, June, and the beginning of July. We should be ready to go with the new office, ready to open using CDC protocols, but ready to open by mid-July. All right, anybody have any other questions? If not, I will turn it over to Tramaine and let her begin with her presentation. Tramaine?
Hello, everyone. It's so wonderful to see you all. I'm very excited about this presentation. My name is Tramaine McMullen. I work at DHEC as the Opioid Grants Manager, and it's my job to make sure that our overdose data to action strategies, OD2A, are disseminated throughout the community, and we increase the capacity as much as we can, and for the purpose of reducing opioid misuse, overdose deaths, and increasing prevention. So I will pull up my screen. It says the host has disabled screen sharing. Is maybe, oh, I'm the host now. All right. There it is. All right. So the purpose of this presentation is to show you what overdose data to action is currently doing within Beaufort County. It's also to show you that the efforts that we know of that have been made for prevention and opioid reduction in opioid misuse and overdose. And then this is an opportunity for us to sort of have a conversation and share any information that I may not know at the state level. Also, always, we love to hear your ideas. The OD2A funding is in a very special time frame where there's a bit of fluidity in how we can look to ways to increase the capacity of local communities. So we're always looking for ideas that we can present to CDC with the hopes of CDC saying you can move forward, or there's a piece of the idea that you can move forward on. So let's get started. So overdose data to action, funding and impact. In 2019, the CDC was awarded funding for 3 years through overdose data to action. Actually, there is an update. They just recently let us know we would be awarded funding for an additional year. So instead of going to 2022, it will be to 2023. Currently, we have at least one strategy being implemented in 41 out of the 46 counties, and some counties are implementing more than one. These are our strategies. The green and the blue indicates the type of strategy it is. You have surveillance, where the efforts are in collecting data from local community, local places in the community, such as hospitals or coroners, whereas the blue represents prevention efforts being done within the community. And I'll go over these in detail. So I did a bit of research, and I looked at used Just Plain Killers, which is a website where a lot of the data comes from DHEC and DHEC working in collaboration to just look at statistics regarding Beaufort. So in 2019, according to Just Plain Killers, there were over 100,000 prescriptions dispensed, over around 146 naloxone administrations via EMS, and 243 opioid-related hospitalizations. When I looked up some newspapers to see sort of what we're looking at for 2020, the projections for 2020 were that the overdose deaths would be around 57 or more. And I put a link to the article where they were projecting that the overdose deaths were going to increased in 2020 by 222%. So what you see to the side is a representation of the numbers from 2017 to 2019, and then using the 26 deaths reported through the DHEC website, I calculated what 222% would be. So there's an estimated doubling of the deaths. So when it comes to OD2A, the surveillance strategies are as following. For strategy 1, that's where we collect and disseminate timely emergency department data. So we work with hospitals, and they send us data based on hospital codes, and we use those codes to determine how many people came in related to opioid misuse, opioid overdose, things like that. That information is collected by DHEC and then sent to CDC, where they use a national website to store and report that information. The final part of this strategy would be working with the communities to getting this information back. So that's something that they'll be working on starting in year 3. For strategy 2, that's where we work with the coroners to collect information, and that usually involves us creating more robust death certificates. So we have abstractors who abstract data and then use additional data points, especially when it comes to sort of describing what was involved when a death has had an overdose component. In addition, we have the suspected overdose death checkbox, which is available to coroners on the electronic death certificate. This is so we can sort of have a number ahead of time. Toxicology reports can take weeks, and with what's going on right now, it can take months. So it's really good to have sort of real-time feedback on deaths that are suspected to be related to overdose in communities.
Tramaine, we have a question from NAMI. They're wondering, are any of the opioid deaths considered to be suicides?
I'm not sure if that is what is with the coroner, the abstraction, but I have a meeting with the strategy lead on that today, and I will ask that question and I will get back to you.
Great, thank you.
Thank you. For the third part of the county coroners, that's where we are, we're in the process of developing a content management system. And that's where there's sort of a standardized way coroners enter their data. That's part of our innovative strategy. So it's a bit fluid right now. We're really seeing that we may have to take a few steps back and really work on strengthening our engagement with the coroners and building capacity. So that strategy, the original intention was to just build a content management system. However, there may be additional aspects in that to come, since we have a decentralized type of coroner system where every coroner is elected. So we realize that we have to work a bit differently to strengthen our engagement with our coroners. And so that's where we're starting from. The third one that I'm going to go into more detail about in surveillance is when DHEC analyzes specimens or honestly, plain language urine samples from the emergency department to identify illegally manufactured fentanyl. So a patient comes in, and if the patient is suspected of having something to do with overdose, there's a sort of standard process they use to identify that. And when that patient's blood samples, urine samples go to the lab, those urine samples are then sent to DHEC. And then we analyze those urine samples for illegally manufactured fentanyl. And that's really important because a lot of deaths are caused by fentanyl. And this is happening where someone is creating their own illegal pill on the streets. There's a lot of teens and there's a lot of people who have unknowingly bought Xanax or something that they thought was harmless from a non-licensed source. And unfortunately, it only takes 1 or 2 pieces of fentanyl the size of 2 grains of salt to kill a person. And so the earlier communities know that this is happening and that this is on the street and what percentage of people coming in the hospitals have this in their system, the more communities can work together to address what needs to happen next. And so my next slide is going to show you sort of where we are in that process. Our team has done a phenomenal job. And then the good news is that, as you can see with the strategies, Hilton Head is already participating with sending emergency department data. The coroners have already, for strategy 2, the coroners have already sent at least 1 abstracted record to DHEC. And then the county coroner has used the checkbox at least once, and the Hilton Head Hospital is in the process of participating in strategy 3. The estimated date for when they start sending samples is June. So we'll go to the next screen. So this is the data that strategy 3 is compiling and continuously updating. It shows where we are with getting hospital participation and then what those numbers look like when we receive samples. So if you look at sort of the salmon color, that's where pending MOAs, those are hospitals that are in the process of being onboarded, and Hilton had at the top of the list in June, as I stated before, is when they should start sending their samples. But if we look at the red, those are hospitals who have active MOAs with DHEC, and with the red circles, those are hospitals who have sent samples and have active MOAs. So a hospital could have an active relationship with us, but they haven't started sending samples yet. So for the hospitals who sent samples, 24% of Kershaw samples had illegally manufactured fentanyl. And what we have to realize is that's just 24% of the samples sent to DHEC. So there could be a lot more, because whether in the emergency room, someone recognizes that this person may have illegal substances in their blood, that's really up to the doctors. So, but it's pretty striking that at least a quarter of those samples have fentanyl. Also, we look at Florence, and then we look at Horry County. That's around 15 to 16% with both of them. And so that just lets us know, just gives us a better picture of what each county has in the community. And that would help on multiple levels, depending on how that county chooses to address this. And it could be as simple as making sure people in the county have an increased awareness that this is happening.
Tramaine, your previous slide mentioned that Beaufort Memorial Hospital was participating, but I don't see them on the list. Where do they fall in this pattern?
Hilton Head Hospital?
No, Beaufort Memorial. See it in your top right underneath Hilton Head Hospital. Then you have Beaufort Memorial Hospital.
That's for strategy 1. Strategy 1 is a different strategy than strategy 3. Strategy 1 is where they collect and disseminate the ED data. So the hospitals send the data codes to DHEC. So that's a totally different department.
Gotcha.
Strategy 3 is our chemists. They have a huge lab, machines with cool names. And actually, I can't call it machine anymore. They told me it's equipment. So, yes. Don't tell them I said machine. All right. So this is a really exciting strategy that I wanted to let you guys know about. I had a meeting with Strategy 3, and they really wanted us to go into detail with communities, which is why I go into detail with Strategy 3. And the final slide on Strategy 3, these are the benefits. 1, the hospital gets a banner. Yay, everyone loves the banner. What a banner can do is really show the local community that the hospital is really invested in what the community is going through, and that this is a place that they can feel safe, and that this is a place that they can feel confident is taking care of their community in all different aspects. Also, within the hospital, having a banner really can energize the staff and have them be on the lookout, knowing that they're participating in this program, and it could lead to increased participation in samples being sent and a more accurate description of any illegal substances that is being distributed in the community. Also, this can help with real-time feedback when they participate. As I said before, toxicology results can take weeks, and it's actually more likely months now, especially with COVID. So a person may not understand exactly what had happened to their loved one for months. And the community may not know if there's a spike for months. But this is another way for us to close the gap on an issue that is really time sensitive. Because if there's a bad batch, it doesn't just strike once, it strikes multiple people, and people need to know. And also, there's the benefit with participation of any additional future substances, because CDC is interested in expanding the scope to polysubstances and probably illicit prescriptions. So there are going to be a lot of things being tested in the future. And we want to give people who participate, communities who participate, the benefit of that additional knowledge of their community. Also, this can help strengthen the partnership with the hospital and the coalitions and increase the capacity for data dissemination and opioid spike preparedness in the communities.
Tramaine, we have a question.
Yes.
From Jill Dawson, she's asking, is it suspected that the huge increase in deaths is due to the increased stress and isolation from COVID?
Yes.
Is there a particular age group that is suspected to have the largest increase, for example, school-age children?
I'm not sure. I looked at some data when it came to Beaufort County. The increase is actually coming with middle age, like late 30s and 40s, when it comes to that kind of stuff. And that's what the data says. With what I looked at, I'll have to look at it again to make sure that's what it was saying. With school-age children, that is definitely an increased risk. And I've seen a lot of articles where there's increased deaths among school-age children. The issue that I think is happening as school-age children deaths are increasing, so are the other groups. So I think everybody's sort of seeing a rising tide in the opioid COVID sort of conjunction.
Okay, thanks.
Thank you. And the person of contact when it comes to strategy 3 that DHEC is working with for Hilton Head Hospital is Carmina Pasquale, maybe Pasquale, and that's her phone number. And of course, everyone is going to get a copy of this presentation afterwards. So that's just something for you guys. All right. Moving on to prevention. So in our prevention strategies, we're going to start with the PDMP. PDMP is the Prescription Drug Monitoring Program, and it helps doctors and providers identify prescription use and history among their patients. And medical facilities and providers are approved to utilize this service. So if someone comes in and they want a prescription, people who are connected with the service can really see what's that person's history. And now, because of a new law in South Carolina starting the beginning of this year, hospitals that have to administer naloxone have to put that in the PDMP. So people who are using this can see that this person went through a situation which required naloxone or something like that. Right now, there's 16 organizations integrated. I have the list at the end of this presentation, but that doesn't mean only 16 organizations use PDMP. It just means that they're integrated to a point that we can see at the state level that they're in the system, and we have data at the state level. So there could actually be maybe 100 organizations using this, but this is we can only really identify 16. For strategy 5, that's local prevention efforts in the community. And the first one is a COPE program, and that's working with law enforcement, EMS, and fire department, and they're being trained to just provide a step in the gap, including providing naloxone, also coming to make sure that people who need treatment get the attention that they need. And from our last meeting with Beaufort and from maybe additional information I received in the meantime, I know that there's a grant in progress for that, but it's not through DHEC, but no, it's not through OD2A, but I think it may be DHEC, if someone could correct me on that. We'll get to that one later, but I know there's something going on, but it's not through OD2A. Also, we have the Strengthening Families program. According to what I know now, we don't have anything going on in Beaufort at that level. The Strengthening Family program is when we work with families who may have a proclivity to drug abuse or misuse. And they go through training as a family to enhance their skills. And this program is evidence-based in preventing drug use among the family and helping the children who may be in a situation that's less than ideal, giving them the skills to reduce their chance of future drug use or misuse. For the life skills program and the good behavior game, that is something that Beaufort is involved in. And again, this is not through OD2A, but it may be through another funding with DHEC. And before I send this presentation out, I'll have the exact place that this funding is coming from. And so it's clear to everyone. Also, going on to strategy 6, again, that's linkage to care. Well, on DHEC side, there's a TBD there because with our health departments, the linkage to care efforts were when if someone walked into the health department, there'd be a way for people to be referred to a treatment center. The health departments are already doing it, but it's not standardized and no one's gathering information. So we were going to start a pilot to sort of standardize that process and gather data on it. However, because of COVID, that's been pushed back a couple of times. So that's why that says TBD on the OD2A side. However, there are communities that do have efforts to identify people who may need treatment. So so in Beaufort County, if there's any efforts along those lines, we definitely like to know. For the second part of strategy 6, that's motivational interviewing for COPE counselors. Either from our previous meeting or from my research, there is a grant in progress for that. And I will again, when I send this out, I'll have the exact details regarding who, what, when, and where regarding that particular strategy. Academic detailing is strategy 7. That's where medical practitioners and providers are educated on opioid misuse and ways to interact with their patients in a way where either there's a better way to prescribe drugs that can be addictive, or there are drugs that you can prescribe that may not be. And so they're educated on that, and they're also educated on just addiction in general, because a lot of people may not understand how quickly someone can be addicted if they're given pain medication for a simple injury that could be just like a car crash or something like that, and how careful we need to be when we are prescribing these types of addictive drugs, and also how to watch patients to make sure they're getting the best possible care on both ends, treating the pain and monitoring if there's addiction. So according to OD2A is doing that through Beaufort County. And I think I have a list of that towards the end, and of the people that they've worked with towards the end. And if I don't, it will be in the presentation by the time it's sent to you. So I'm putting number 7. So for the vulnerability assessment, that's when we look at communities and we look at anything that has to do with injection drug use and Hep C, HIV, things like that. And we really see what are things that are going to help mitigate injection drug use, and what are things that are going to help, or unfortunately things that help facilitate high rates of injection drug use. The reason we do that is because a lot of that is correlated with opioid misuse. And so what we do is we work with different communities and we give information to different communities about this. And from the check mark means that, yes, they participated in this. At some point, the Beaufort community has been contacted regarding this. Also, in strategy 8, you'll see that it sort of has a link. I have a link to the updated vulnerability assessment report that has information about all of the counties. For strategy A2, EMS law enforcement, there is a grant in progress regarding OD2A maps. Also, for strategy 9, reaching residents through media presentations to the community and faith-based virtual presentations. There is a grant in progress regarding reaching SE residents through media, and that's through the SOAR grant with DHEC that I will that I actually have a slide on, so you can see sort of overall what's being funded for a portion of this year. And finally, innovative video series. There's a check mark because there's things being done in the county that is spreading the message of opioid prevention through video. In summary, great job. We're close to a 10 out of 10 in Beaufort County. There's a lot you guys are doing holistically to address the opioid misuse and overdose crisis. Just to give you reference, there's some states there's some counties that are only participating in 2 to 3 strategies. So the strategies that have participation at some capacity, I have here, and then strategies that we may gain funding for soon are below, and strategies that Beaufort can partner with DHEC on would be A1 and strategy, which is the one where linkage to communities and referrals. And that's something where we're definitely looking for any innovation on. And then strategy 9, where, more education to communities and also more education via faith-based organizations. So this is additional partner efforts. Recently, DHEC, through the State Opioid Response Prevention Funding, which supports evidence-based prevention strategies, they were able to fund around $49,000 to the Beaufort County Alcohol and Drug Abuse Department. And within those strategies, we have education and awareness strategies, opioid and stimulant stigma reduction strategies that they're funded to do, proper medication storage strategies, and community event strategies. So these are things that I'll probably be reaching out to Beaufort County on just to understand exactly what they're doing so we can sort of update our presentation and articulating the efforts going on in Beaufort County. So the next steps that we're doing just to increase our engagement is we would like to understand the following coalitions that are involved in overdose reduction and prevention. And this is something I can be sent an email on towards the end of the presentation, right? And here is a list of the things that we found on our own that sort of gives us an overview of what's going on in Beaufort County. And if there's anything missing, please let us know. And this is going to be very important for us. And that's because when it comes to data dissemination and information dissemination, we'd like to get it to a place where there's sort of a listserv where we can reach out to people if there's any information that needs to be disseminated, and also keeping people up to date what's going on across the state and also in Beaufort County. Also, one of the things that I was very pleased to find out was that Beaufort County has a very, very robust presence when it comes to data dissemination via newspapers and online articles. I was very excited to see, and it's not 225, I'm sorry, that's not correct. It's 222%. So I'll correct that. My apologies. So one of the things that I found was that there are a lot of articles that show that Beaufort is addressing the opioid crisis sort of across the board. The articles I found that Beaufort teams up to fight opioids. So WTOC 11 was very active. The Island Packet has a lot of articles, but I think you have to be a subscriber to get to some of those articles. But I really think that would honestly be a good investment on DHEC's part because they really tell stories at the local level. There's articles that discuss the statistics. There's opioid mortality data. There's information about the Burton Fire District doing Narcan training. And there was also, towards the bottom, information about them suing over the opioid crisis, which was a couple of years ago. So this is really interesting, and it really gives me historical and current reference to what's going on in Beaufort County. In addition, if we need to reach out to any specific news or online sources about information, this also lets us know people who have a history of investing in the crisis. So one of the articles that I wanted to bring to the forefront that I really liked was the Burton Fire District article, beginning life-saving Narcan training. And so one of the things that it just discussed was that on April 10, there's going to be a free curbside drive-up Narcan training on April 10th, and that's through the Beaufort County Alcohol and Drug Abuse Department. So that's just one of the articles that I really enjoyed looking at. Just showing what's going on in Beaufort County. One of the reasons that we are really interested in this, we have an excellent opioid communication strategist. His name is Mark Swart. And one of the things that he started doing is, we call it the Swart Report, is where he gets news across the state regarding opioids that's just really important. And he sends it out to stakeholders. And these are things that can help people understand what's going on just in local communities and at a state level. And the reason we like to do this is we want to collaborate. We want to understand social media outfits regarding opioid prevention. You know, when people have videos, especially when they have Facebook videos, we do watch those things, and we're really engaged in being a support wherever we can. So when it comes to next steps, this is a time I give everyone to give me feedback and ask questions regarding the presentation, or just give me feedback on anything that they would like to discuss. Do we have any questions or any feedback?
I think there's been several comments. Ben, you want to run down what they were?
Yeah, there was one question about how or whether or not DHEC is working with local pain clinics to handle possible fraud or excessive pain medicine requests.
Not that I know of at the moment. However, I'm going to take this to my director. And who asked that question?
Ms. Mary Ann Radke.
If she could put her information or send me an email, I will get back to her on that, and we'll go from there. As I said before, there is an opportunity for us to sort of expand our scope. And if this is something that CDC sort of approves of, we'll look to see if this is something we can support the communities with. And next question, but right now, no, we're not doing that.
Do you have access to any recent like age distributions for opioid deaths?
No, I actually was looking for that information. And no, I don't have access to 2020, official 2020 data right now, or 2021. All I can, that's why we're sort of working with the hospitals and the coroners and the samples, so we can sort of get access in real time. Unfortunately, historically, we've always been a year behind in having official data on that.
Okay. You mentioned the Strengthening Families program earlier. I know that Hopeful Horizons and School District both offer a Strengthening Families program, but that one's not necessarily focused on substance use. Are those different programs, or do you think it's just a modification of one to address substance use problems?
No, it's actually the same program. The Strengthening Families program, Strengthening Families program does not directly address substance use. It strengthens the skills of the family, so they're in a better position not to, I guess, be in that position where that could be an issue, or if the family already had an issue with it, they're in a stronger position not to relapse. It's an evidence-based program. Through skill building, they reduce the likelihood of ACEs, which is adverse childhood experiences. So yes, it's the same program. So you're saying Hope Horizons and the school district is implementing Strengthening Families program?
Yeah, I think it's a school district. I think and Fred, you might correct me on this. I think they subcontract, or the school district subcontracts with Hopeful Horizons to provide it, don't they?
I know we have a couple of agencies that do Strengthening Families. The Hopeful Horizons obviously is one, and then the school district, like you say, contracts. I think also Right Directions Family Services, which is another organization in the community. I think they also provide the same thing.
Wonderful. I'll reach out on this so I can update the information we have. Rightful Directions Family.
WRIGHT, Right Directions Family Services.
All right. Thank you.
I think that's everything I saw in chat. Unless anybody else has any questions, if you guys want to throw them in chat real quick.
I noticed that there's a comment from Katie Godowns with Beaufort County Alcohol and Drug Abuse that they do have an SOR2 grant that's in process right now. And I also see Dan Byrne from the Burton Fire Department mentioning that they misquoted the statistics. Dan, can you tell us who you meant by they? Was that the newspaper, or were you talking about Tramaine's presentation? Because she already did note that it was where she had 2,225. It should have actually been 222%.
Yeah, we got, I didn't see us in the Gazette, but we got coverage from WTOC and WSAV came out. And I can't recall the 222% they credited to us for our statistics, when it was y'all's statistics. And I thought I saw that in the headlines as well. But the point got across. It's just, they just misquoted that statistic. It's an accurate statistic, just not for our district, but for the county as well. But we took the information that you provided. We have a pretty good relationship with the local media. They're always looking to do things along those lines. And we caught them on a slow news day, so they covered it. So we're happy with that.
Thanks, Dan. Also, there's a comment from Connie Hip that you mentioned Moorhead City. That's an organization in Beaufort, North Carolina. So you might want to correct your data there.
I'll take that out. Thank you.
That's a comment from Connie Hip.
Connie Hill. And also, I think Katie from SOAR, Katie from Beaufort Alcohol and Drug Coalition. I would like to contact her regarding more in-depth knowledge about the strategies being implemented, if that's okay, Katie.
Yes, you're welcome to contact our director, Steve Donaldson. I can send you
yes.
in the chat.
Thank you so much.
You're welcome.
I think that was the last question or comment that I saw. Anyone else have any questions or comments for Tramaine?
All right. Well, thank you guys so much. It usually takes me a couple of days to update presentations with the feedback that I received or make any corrections. What I'll do after that is that I'll send you guys a PDF version. And of course, the PDF version will have the links, all the links that I mentioned provided. And other than that, please feel free to contact me regarding anything. And thank you so much for giving me this opportunity to present.
Thanks, Tramaine. Also, Katie just posted Steve Donaldson's contact information in the chat line if you want to grab it from there.
All right, I'm looking at it now.
All right, great. Thanks very much, Tramaine.
Thank you.
All right, at this point, we're going to move into announcements. I'm going to run across my screen and call out the names of people as I see you so that you have an opportunity to give any kind of an update that you're interested, or you may pass depending on what you have to say. So I'm going to start with Connie Hip. Connie, do you have any announcements? Oh, great. Okay. Alec, can you unmute Connie for us?
Ben currently has the con.
Oh, okay. Actually, Ben, this might work better if you call them out. That way you can unmute them as you do rather than have me do that.
I need Tramaine to pass host back, sorry.
Tramaine, can you give the host back to Ben?
And how do I do that?
You can just put your mouse over over my little window and hit the little dot, 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 and you'll see it in that list there.
Make host. Yes. Here you go.
Thanks. Sorry about that. Fred, my list is a different order than yours. So
Yeah, why don't you just go down the list according to the way you see them, and that way you can unmute people at the same time.
oh, hold on. Now my list is changing and different people are at the top.
If I'm made host again, Ben, I can fix some things. It doesn't have to happen, but it can.
Fred, it might be better if everybody who has an announcement just let us know in chat, and then we can just go down that list instead.
Oh, okay. Anyone? Okay. Let's start with Connie. I see she says that we still have some of the military resource guides in case anybody wants some of them, and she's happy to deliver them. Angela Childers says she has an announcement. Angela?
Hi, good morning. Good morning, everyone. I just wanted to say that we still have veterans vouchers available. So if you know of a veteran who is homeless, or as HUD likes to say, in almost homeless, please send them our way. The veterans coordinator from the VA is in our office every Wednesday. So he's here and available, but they don't have to come on Wednesday. It just makes it easier. And that's all I have. Thank you.
Great. Kimberly, you have an announcement from the Disabilities Coalition?
Hello, everyone. We are getting ready to go to production for our Disabilities Coalition resource guide, and it will look similar to the seniors guide as well as the military's guide. And so it should be out hopefully May 1st.
Great. Thanks, Kimberly. Kathy Stegall, you have something with Memory Matters. Kathy?
Good morning. I am in place of Debbie Anderson this morning, but I get a chance to come on. I am the Family Services Navigator at Memory Matters. It's a new position for me, but I have been with the organization for 15 years, helping those families that have a loved one with dementia or someone who has worried. We call it the worried well. We are doing online memory screenings for all. There's no cost for that. As well as we've just started a new program called Savvy Caregivers that's evidence-based and is recognized by the U.S. Administration on Aging. It's to help the families who are caring for a loved one reduce their stress and really understand the disease more. And it's a 6-week program we are doing online for families. And all of that information is on our website. And I can link that website if no one has that available.
Great, Kat. Thanks, Kathy. Wade, do you have something for alcohol and drug? Somebody can unmute Wade Bishop, please. They're probably looking for you on the list right now. There you go. Oh, wait, you were on the list.
Fred, he can unmute himself too.
Good
There you
morning.
go.
Tramaine made reference to the event to occur on the 10th of April. It'll be from 10 to 1, but a key component of that is the Narcan distribution. It's free Narcan that includes the training for family members, roommates, just concerned people that may have someone in their life that may need the access to the Narcan over time. We also started having a relationship with the recovering community. So at both Bluffton and Beaufort, there are typically people or representatives from the NA community, the Nar-Anon community. Al-Anon has participated, so that when people drive up to the curbside event, they can also interact with people that are living the experiences that they may have. And therefore it's a one-on-one sharing from car to the volunteers. So anyone's able to come, it's 10 to 1 here at the Beaufort office, the Human Service Building, and in Bluffton on Myrtle Parkway, or Bluffton Parkway is called Myrtle Park, the southern branch of Beaufort County government offices. And thanks for your time.
Thanks, Wade. Dr. Leyda Novins. Dr. Novins, you had a comment?
Yes, I wanted to follow up with some information that Wade provided, which relates to April 24th being RX Take Back Day. And on that day, Low Country Alliance for Healthy Youth will be collaborating with the Sheriff's Office and with BACADAD. At that time, the community members will have an opportunity to drop off their meds at the Beaufort County Government Building here in Bluffton. And our youth coalition, Teens for Healthy Youth, will be participating in that event. They will be giving RX fact cards to the individuals dropping off their meds, along with medicine safety tips for families and for children. The coalition at large will also be distributing those fact cards electronically. Wade, did you have anything to add to that?
No, we're just doing finalized plans with the Sheriff's Department as of yesterday.
Okay, thank you.
All right, great, thank you. Genesis, you have something with Bluffton Self-Help?
Hello, everyone. My name is Genesis Gonzalez, and I'm the Education and Resource Center Coordinator in Hardeeville. So I'm here in place of Kimberly Hall, our Executive Director. We just want to let everyone know that we have expanded to Hardeeville. So we're providing services with GED preparation, ESL classes, resume building and writing, pretty much. And learning. Oh, and WIN learning as well. Barbara Bowers is also here.
Hi, everyone.
So yes, we just wanted to let everyone know that we are now here in Hardeeville. So we are located inside the library in Hardeeville in the computer lab.
Great, thanks, Genesis. Sandy Gillis with Deep Well Project has an announcement. Sandy?
Yeah, just a quick reminder that with the IRS extension to May 17th for filing taxes, the VITA site that we run here at Deep Well will remain open certainly through the end of October and probably into early May. And those times for people who do need help with filing their taxes are 4 to 6 p.m. every Tuesday and Thursday. Generally, we can turn them around in about 2 days. So just wanted to let everybody know that that was still available if you put it off. Thank you.
Great, thanks, Sandy. Ann, you have something from Low Country Legal Volunteers? You got to unmute yourself. There you go.
Oh, I'm here now. Thank you. Good morning, everybody. I'm with Low Country Legal Volunteers. We have a couple of community clinics coming up on May 6th and May 20th in Bluffton at the Parish Hall of the, just had a blank, the Episcopal Church in Old Town. Sorry, took me a minute. And so I wanted to let you guys know about that. It's a Know Your Rights Legal Clinic. We had presented that, I think, in January previous to the HSA group, but we're focusing primarily on landlord-tenant issues since that's very timely. But we also have a really special speaker that's joining us, a local attorney, Amy Deverall. She's going to be speaking on immigration issues as well. So we'll put that up on our Facebook and just wanted to share that with you guys.
Great, thanks, Ann.
Thanks.
Maggie Young. Maggie, you wanted to give an announcement?
Yes, good morning. My name is Maggie Young, and I'm a program coordinator with the MUSC Boeing Center for Children's Wellness, and I am happy to have the opportunity to join this alliance and just to let y'all know that we are actually working with schools throughout the district to help grow and foster their cultures of wellness in the schools.
Great, thanks. We're hoping that this program will help us to reinvigorate our Eat Smart, Move More Low Country coalition as well.
Absolutely.
Anyone else? Anyone else have any other comments, announcements? or questions about anybody else that has already spoken?
If anybody thinks of anything later, just feel free to email me, and I'll be happy to follow up.
Ann just gave another note here. May 6th and 20th, Know Your Legal Rights Clinic with Amy Deverall speaking on immigration issues at 6 p.m. at the Parish Hall of the Church of the Cross, Old Town Bluffton. Thanks, Ann. And we have a request from Marianne for Tramaine's contact information. Ben, can you post that? There you go. Anyone else have any announcements or questions or comments before we move to adjourn?
I have one.
Charmaine, go ahead.
Just tomorrow starts Child Abuse Prevention Month. So if everybody would like to wear blue tomorrow, post it. You can put it on our Facebook, you can put it on yours, and just spread the word.
Great, thanks. All right, I'll give it another second or two to see if anybody else wants to say anything, and then we will move to adjournment. While we're waiting for that, I'll just let you all know that our next meeting is scheduled for June 30th. So please make a note on your calendar so that you can participate. Mark Williams. Mark, you had something you wanted to say? Got to unmute yourself. There you go.
Yes, good morning, and thank you for the opportunity. My name is Mark Williams. I'm the center operator for the Beaufort, Hampton, and Colleton one-stop centers. And I know that everybody's providing services, but I just wanted everyone to know that we do have employment services for everyone in the Beaufort County area. So if you know of anyone who's having issues with unemployment, or looking for employment, or looking for training, anything of that nature, GEDs, resume writing, all of that. We're a one-stop center, and we can help any and everybody with that. So don't forget us here in Beaufort, 164 Castle Rock Road, Beaufort, South Carolina, 29906. Thank you for your time.
Mark, if you would put your contact information in the chat so that everybody can make note of that in case they want to get a hold of you afterwards.
Will do.
All right, thank you. Okay, last chance. Type in the chat line now if you want to say anything before we adjourn. And seeing none, I will call our meeting to a close. So thank you, everybody. We really appreciate you giving us your time, and great turnout today. We had 43 people. I think there was actually a few more that were here earlier and had to sign off to go to other meetings. But really appreciate everybody participating, and look forward to seeing you all on June 30th for our next meeting. We will probably just keep an eye on the newsletter to determine whether we're going to do that face-to-face or whether we're going to do it virtually. All right. Thanks, everybody, and have a happy Easter. Bye-bye.